I think one of the things the pandemic revealed is the huge gaping hole in so many of our healthcare systems that we do not provide mental health support for doctors and nurses. We just don't have it. One reason is the way hospitals are led. They're led very often more like businesses, and providing mental health support for doctors, nurses, and staff is on the L side of the P&L. And I think it's just a gaping hole that we have to fill, which these are high stress jobs. And even in the best of times, it's still a high stress job. And there should be services provided by every hospital that have staff there, not for the patients, that staff there simply to take care of the doctors, nurses, and staff who are on the front lines, whether there's a pandemic or not. And the fact that we hadn't invested in it means that those resources were not available when we needed them most. Even the military in the United States has mental health units that deploy with their doctors and nurses into combat zones because the stress is so high. So if the military is doing it and understands it, why aren't we doing it in civilian hospitals? So that's number one. Number two, it's about taking care of each other. And this is, in these difficult times, one of the funny things about high stress is high stress sometimes brings people together. Shared hardship releases oxytocin. Shared hardship, shared struggle actually creates very deep, strong bonds of trust. The friendships that I'm sure that they're building are actually probably deeper than they ever thought they'd ever build with their colleagues in the past. They're becoming their new families. And so there's huge opportunities for socializing. I'm sure there's lots of gallows humor, but the important thing is that they can disconnect as a group, that they can socialize. Anytime that they can have rest together and interact and play games, all of that stuff really, really matters. And then there's also the opportunity to, you just said it, Holly, be the leader you wish you had. Leadership fundamentally is the responsibility to see those around us rise. And one of the best ways to deal with our own stresses and strains is actually to help others who are dealing with the same stresses and strains. When I wrote Leaders Eat Last, I had the opportunity to learn more about Alcoholics Anonymous. And Alcoholics Anonymous, like other 12-step programs, most of us know the first step, which is admitting you have a problem. But most of them know that it's the 12th step that matters most. That if you master all 11 steps and not the 12th, you're probably more likely to succumb to the disease. But if you master the 12th step, you're more likely to overcome the disease. The 12th step is to help another alcoholic. Service. And so if there is somebody who's really struggling with their mental health and missing their families and the stress and strain of being on the front lines, then the amazing thing is it's our opportunity to help them that we're actually more likely to help ourselves. Service to each other. And even if we're exhausted, even if we're absolutely exhausted, to be open and honest, to say, I'm exhausted and I need help. And I know from talking to friends who are doctors and nurses in COVID wards that in many hospitals, admitting weakness or saying you're exhausted or asking for help is a big no-no because of the culture that they have. And I think that's a huge opportunity for people to be more vulnerable about their own needs and desire for help and need for help. And the person who goes first is the leader, because the person who goes first will set the tone. Someone else will try, and someone else will try, and before you know it, you have a lot more honesty and people asking for help who really need it, rather than hiding it. It's a great question. My big fear is that in healthcare the problem is not over. That when finally the COVID numbers come down, that there will be so much exhaustion and burnout that we're going to lose a lot of people from the profession, and we'll have a void of doctors and nurses in general. And so I think this is still yet to come. And again, it goes back to building up those mental health units to support people along the way, not waiting for the next emergency to happen.